Hi, YouTube. Welcome, everyone. It's a lovely Tuesday. It's such a pleasure to be back. My name is Ada, your online therapist in the making. So, guys, I want to continue where I stopped the previous video last week on depression. So, we're talking about mental health basically, and depression is a mental health disorder. And just like bipolar disorders, schizophrenia, these are mental health illnesses that need to be taken seriously. It's so important, and it's rather saddening that people are being told, get over it, deal with it, what's wrong with you? Why are you so such and such? Get off the pity horse. These are serious illnesses that actually require proper medical diagnosis, proper treatment, and all the stuff that come with medical issues. It's a medical issue. It's a medical emergency, if I should put it that way. Okay, guys? So I'm going to be talking about what depression is not in this video, and the common remedies or solutions that someone you know, or if you are dealing with depression. Please, disclaimer, this YouTube channel is strictly for informational purposes only. If you do have depression, please visit a licensed therapist or your doctor to get these diagnoses so that you can get the right help you need. So depression is not sadness or grief, and grief is not depression. Yes, they do have similar experiences such as painful feeling, self-esteem, and thoughts of death. Okay? When we talk about pain or grief or sadness, pain comes and goes. There's a mixture of good memories and bad memories that produce painful feelings. Even good memories, when you have nostalgia, they can also produce painful memories, right? Painful feelings, I beg your pardon. With depression, it's a mood disorder. So those painful feelings don't necessarily go away. There's no positive memory that intertwines or mixes with a depressed thought or feeling. It's constant negative, downward spiraling, defeated, painful memories, really. And when you talk about self-esteem, when you're feeling pain or grief, it does not affect your self-esteem. Your self-esteem is exactly where it was before. Whatever happened. It has absolutely probably nothing to do with you. You're just probably grieving or sad over a certain thing, and you plan, okay, how going forward, how to fix it. With depression, your self-esteem takes a massive blow. You consider your worthlessness, you consider your value to yourself, society, family. You feel like nobody needs you, nobody cares if you exist. A very detrimental, self-deprecating sort of attack on your self-esteem. And then the third thing is basically when we talk about death. When you're grieving, people grieving, very, very strong grievers could, have thoughts of joining their loved ones. They're not able to live without them. That's the only reason you want to think of death, because you're missing a loved one. When it comes to depression, thoughts of death are actually to end one's life because one feels worthless, irrelevant, and not loved by family, friends, or even needed in the society. So that's the difference. You talk about your self-esteem, you're thinking about death and painful feelings. So it's depression is a very, very serious, but to be optimistic. When it comes to depression, it is the most treatable of most mental illnesses. Remember, we talked about bipolar and schizophrenia. These are brain diseases, particularly for schizophrenia. So it has to do with brain function. You could deal with medication, but sometimes it just, it's like almost neuron damage, things happen, basically, and it's like your brain doesn't have the ability by itself to fix the damages, or it'll take a longer time. So until such a time when that repair is done, you will have the symptoms and suffer the symptoms of these diseases. When it comes to depression, however, which is a mood disorder, the idea is to fix your mood. All right, the idea is to fix your mood, to improve it, help you basically get out of a mental funk. It's almost like you have the opportunity to fix this because it's mood. It's not deep in the sense that it's not beyond your personal reach in terms of having to rewire your brain when it comes to schizophrenia. But with depression, there are very simple, not simple, but it's like doable treatments. Okay, there's the medication, like I mentioned in my previous video. There's therapy, CBT, cognitive behavioral therapy, very successful. And medication, I think I mentioned medication already. And there's also electroconvulsive therapy, but this is a very much more restricted for patients with severe clinical depression. Usually a team of professional, licensed doctors and nurses and anesthesiologists. There's a whole team when it comes to the electroconvulsive therapy. And there's self-help, take a retreat. Some people go to Bali, to Thailand, take a personal retreat, basically come into yourself, take a trip, take a vacation from your regular lifestyle, just to recoup, get away from the things and people and environment that is affecting your mood, that is creating that feeling of worthlessness, if you understand what I mean. So it's like treatments are doable, they are accessible. I think that's what I'm trying to say. The treatment for depression or clinical depression are accessible, not more than most, but it's almost like for other diseases, for other mental illnesses, you do need professional help, to even start the treatment. But with depression, you can start with yourself, your family, a close friend before you progress to having professional, medical, and all that other help, depending on the severity of your depression. Okay, so guys, we've talked about what depression is not. Okay, it's not grief, it's not sadness, but it will have those things in there, in the sense that, but there are times, like when they meet, such as when someone suffers physical abuse or you lose a job, a loved one, when grief and depression coexist, the grief is longer, basically. It takes a longer time to heal, to get over it, because, and that's why, they say, don't suppress sadness, don't suppress grief, so that you don't build it into something even more difficult to deal with. You want to express yourself when you're feeling hurt, frustrated, angry, sad. Express it, not necessarily at someone, it's basically let it out. That's the typical advice, let out what's happening on the inside so you can breathe, so you can repair, so that your brain can, process or go through it. Oftentimes people are told you don't get over someone, you get through with grief. You don't get over grief, you don't get over loss, you go through it, basically. So so let's talk about the risk factors. So what predisposes you to depression? As I said in my previous video, having a family history, a mom, a dad who, even when we talked about being suicidal, having a family member who has opened that door predisposes every other family member to that symptom or to that problem. So there's a genetic, if someone in your family or lineage or descendant has it, if you are predisposed to having it. Then there's environment, talk about abuse, toxic environment, negative, critical, things that dampen, things that affect your self-esteem, over I talked about what predisposes you. I mentioned genetics, that is, if it runs in the family, and there's your personality. Are you an introvert? Are you a neurotic? Are you, those personality styles that are predisposed to feeling down and, alone, unable to express themselves. Not that introverts or people who are neurotic, but it's just there's a likelihood for someone who doesn't express themselves to basically taking and suppress negative feelings, thoughts, or experiences compared to someone who is loud about and just out there, who tells it to your face as it is and moves on with their life. So your personality can predispose you to depressive moods and thoughts. And also the environment, like I said, if you're in a toxic environment, if you are in a repressive, oppressive, suppressive environment, abusive environment, or relationships also could predispose you to depression. And last but not least, brain chemistry, whatever's happening in the brain. Remember, that's how it starts off with schizophrenia. Basically, there's misfiring of chemicals in the brain. So you want to make sure that you basically talk to someone, have just like you have your annual medical checkup, make sure you also have an annual mental checkup. Just basically, if possible, try and have a vacation or go into solitude, just take stock of your mental health. All right, and I will see you guys in my next video as I talk more about basically other related conditions that could actually have similar symptoms of depression and will have symptoms. All right, guys, so thank you so much for watching. Don't forget to comment, like, and subscribe. Share with those you think might need it, and I will see you in my next video.